Good day, I'm Mharielle Paule from M4B, and today I'm going to demonstrate how to provide bed bath, shampooing, oral care, and back massage to a patient. Gather all the equipments to save time. We have towel, gown, gloves, alcohol, lotion. These are the materials for oral care. And wash basin. Perform hand hygiene and put on gloves to prevent the spread of microorganisms and cross-contamination. Identify the patient and explain the procedure to promote reassurance and provide knowledge about the procedure. After getting the approval of the patient, provide privacy. Put a towel under the patient's head. Place a bath blanket over the patient and then remove top sheets while the patient holds bath blanket in place. This provides privacy and makes sure that the warmth is maintained. Remove the patient's gown while maintaining the bath blanket in place. Fold the washcloth like a mitt on your hand so that there are no loose ends. Loose ends cool quickly and feel cold to the patient. Wipe one eye from the inner part of the eye to prevent carrying debris towards the nasolacrimal duct. Bath the patient's face, neck, and ears. Expose the patient's forearm and place towel lengthwise under it. The towel helps to keep the bed dry. Using firm strokes, wash hands, arm, and axilla, lifting the arm as necessary to access axillary region. Soak the patient's hand in basin, wash, rinse if necessary, and dry hand. This facilitates thorough washing of the hands and between the fingers and aids in removing debris from under the skin. Repeat the procedure on the other side of the arm. Spread a towel across the patient's chest. Wash, rinse if necessary, and dry chest. Expose the patient's leg. Place towel under the leg and using firm strokes, wash, rinse if necessary, and dry leg from the ankle to knee and knee to groin. Wash, rinse if necessary, and dry the foot to prevent irritation, possible skin breakdown, and infections. Do the procedure on the other part of the leg. Change water if necessary. Lower bath blanket to the perineal area. Place a towel over the patient's chest to avoid exposure and chilling. Make sure that the patient is comfortable and make sure that the blanket is in place. Remove gloves and perform hand hygiene. Help the patient put on a clean gown and assist with the use of other personal toiletries such as deodorant or cosmetics to provide the patient's warmth and comfort. The next procedure is shampooing. Place a drain container under to catch runoff water, preventing a mess on the floor. Perform hand hygiene and put on gloves. This helps to prevent the spread of microorganisms and cross-contamination. Provide an eye towel for the patient. Make sure that the water is warm water ranging from 43 degrees Celsius to 46 degrees Celsius. Apply a small amount of shampoo to the patient's hair. Massage deep into the scalp, avoiding any cuts, lesions, or sore spots. After that, rinse it with warm water. Pat hair dry, avoiding any cuts, lesions, or sore spots. This helps remove any excess water without damaging the hair or scalp. Once it's dry, remove the towel. And make sure that the patient is in comfortable position. Perform hand hygiene and change gloves. The next step is providing oral care. Place brush at a 45-degree angle to the gum line, brushing from the gum line to the crown of each tooth. After that, brush the tongue. Have the patient drink some water and gargle it. Provide basin for the patient to rinse and spit. Remove gloves and perform hand hygiene. For the last step, we will provide back massage. Assist the patient to a comfortable position, preferably prone supposition. Remove the covers and move the patient's gown just enough to expose the patient's back from the shoulder to sacral area. Also, lotion the palm of your hand. This massage is called stroking from upward to downward. This rub has a relieving and sedative effect. This next massage is supposed meant to help in increasing the blood supply and strengthens the muscle. Assist the patient in a supine position while maintaining its privacy. Perform hand hygiene. And document all the procedure that has been done. Good day, I'm Mharielle and Paule from M4B, and today I'm going to show you how to transfer patient from bed to chair. First, perform hand hygiene to prevent the spread of microorganisms and cross-contamination. Next, gather all the equipment to save time. For this demonstration, I'm going to use the patient's slipper and chair. After that, introduce yourself to the patient, identify the patient, and explain the procedure. Good day, ma'am. I'm Mharielle and Paule, your student nurse for today. May I know your name, ma'am?
Paule.
Birthday po?
July 26, 1990.
You can also check the patient's wristband. So today po, ma'am, you are scheduled to perform x-ray. So I'm going to transfer you from bed to chair. Is that okay with you?
Yes.
After getting the approval of the patient, provide privacy. So, can you bend your knees, ma'am? Pa-cross na lang po ng arms. Okay. Tapos, on the count of 3 po, lilit po kayo para makaupo po kayo sa palit naman po natin. 1, 2, 3. Pagsuot na lang po ng seat. Tapos, hawak po kayo sa shoulder ko and hawak po ko sa armpit ninyo para makaupo po kayo. 1, 2, 3. Good day, I'm Mharielle and Paule from M4B, and today I'm going to show you how to transfer patient from chair to bed. First, perform hand hygiene to prevent cross-contamination and to prevent the spreading of microorganisms. After that, gather all the equipment to save time. So for this demonstration, I'm going to use the patient's bed and blanket. After that, identify the patient and explain the procedure. So, good day, ma'am. I'm Mharielle and Paule, your student nurse for today. May I know your name, ma'am?
Marjorie Paule.
Birthday po?
July 26, 1998.
You can also check the patient's wristband. So, for today po, I'm going to transfer you from chair to bed so that you can rest. Is that okay with you?
Yes.
After getting the approval of the patient, provide privacy. So, hawak na lang po ulit sa shoulder ko and hawak po sa armpit niya para makapunta po kayo sa bed. 1, 2. Higa na po po. Provide blanket for the patient. Before leaving, make sure that the patient is comfortable. Good evening, ma'am. I'm Mharielle Paule, your student nurse for today. May I know your name, ma'am? Birthday po.
August 15, 1995.
After asking the patient, verify the patient's wristband. After checking the patient's wristband, verify the doctor's order for type of moist heat application, location and duration, and desired temperature. After verifying the doctor's order, review client's chart for medical history that may prohibit the use of compressions. After reviewing the clients, assess the skin around the area to be treated, temperature of the patient, and pain sensitivity. After assessing the skin, inspect wound for color, shape, odor, tenderness, and drainage. Assess also the client's skin and assess also the client's family awareness and vital signs. After all of that, assemble the equipment. For hot compression, we will use hot water bottle if hot water bag is not available, alcohol, gloves, washcloth, and towel. After gathering all the equipment to save time, explain the procedure to the patient. Today po, I'm going to apply hot compressions on your foot to reduce bleeding and inflammation. Is that okay with you po? After explaining the procedure and getting the approval of the patient, provide privacy. After providing privacy, position the client and expose only the affected area. After that, perform hand hygiene and use gloves. After performing hand hygiene and putting gloves, place towels under the patient's foot and apply heat compress on the affected area. Taas na lang. Before applying the hot compress, make sure that it is secured tightly to prevent leakage and wrap it in a towel to protect the patient. And put it in an upward position to prevent leakage. Remove it after some time. After that, ask the patient to describe level of comfort and burning sensation following the treatment. After doing the procedure, remove gloves and use alcohol. After performing hand hygiene, document all the procedure that has been done. Good evening, ma'am. I'm Mharielle Jolyne Paule, your student nurse for today. May I know your name, ma'am? Birthday po.
August 15, 1995.
After asking the patient, check the patient's wristband. After checking the patient's wristband, verify the doctor's order for type of moist cold application, location and duration, and desired temperature. After verifying the doctor's order, review client's chart that may prohibit the use of compressions. After reviewing all the data, assess the client's skin around the area to be treated, the patient's temperature and pain sensitivity. Inspect wound for color, shape, odor, drainage, and tenderness. Assess also the family's awareness and the vital sign of the patient. After all of that, assemble all the equipments. For cold compressions, we will use alcohol, ice, gloves, underpad, and towel. After gathering all the equipments to save time, explain the procedure to the patient. So today po, I'm going to apply cold compress to sore areas of your body, which is your foot, to reduce the bleeding and prevent inflammation. Is that okay with you po? After asking the permission of the patient, provide privacy. After providing privacy, position in bed the patient and expose the area to be treated only. After exposing the area, perform hand hygiene and use gloves. After putting on gloves, place underpad under the patient's foot and apply compress to the affected area.
Paangat na lang.
Before applying cold compress, make sure that it is wrapped correctly to prevent the ice from leaking. Apply it for the desired period of time. After applying, check the skin condition for effectiveness of the procedure and ask the client to describe level of comfort. After all the procedure, remove gloves and perform hand hygiene. Lastly, document all the procedure that has been made.